I have my little model. So I have a little uterus and a little baby and a placenta. Hi guys, I'm Dr Bronwyn Hamilton, obstetrician and gynecologist. Welcome to my YouTube channel. Today I wanted to cover a really interesting topic which I have been requested to cover, which is placental issues. So here I have my little model. So I have a little uterus and a little baby and a placenta. So as many of you may be aware, the placenta is a really important organ that helps the baby grow inside the mum. The placenta starts forming from the very early stages of pregnancy, and its role is to provide the baby with important nutrients such as sugar, glucose, and oxygen, and also remove the waste products from the baby via the mum. So the first placental issue I'm going to talk about today, which is a really common one, around 10% of pregnancies, is a low-lying placenta, which can lead to Placenta Praevia. So at 20 weeks, every mum who is undergoing maternity care in Australia will have an ultrasound at 20 weeks, which has a look at the anatomy of the baby and also has a look at position of the placenta with regards to the cervix. And a low-lying placenta is where your placenta is within 2 centimeters of your cervix. If that happens, which about 10% of women will have a low-lying placenta, we will perform an ultrasound in the 3rd trimester after 30 weeks to have a look at the placental location again. If that placenta is still within 2 centimeters of the cervix, we call that Placenta Praevia. The implications of Placenta Praevia is that you may have bleeding and you may also require a cesarean section birth at term to minimize the chance of you bleeding during labor or after labor. And the other issue with having a low placenta is sometimes that placenta can be in the way of the baby's head descending in the birth canal during labor. The second placental issue I wanted to chat about today was placental abruption. Now, this is a more rare one, probably about 1% or less of pregnancies will have a placental abruption. But basically the placenta usually will be attached well to the wall of the uterus inside, and a placental abruption is where you'll have bleeding behind that placenta, and that can lead to issues such as bleeding, contractions or abdominal pain. It can also set off labor, and it can lead to issues with our baby's health. So this is a really serious condition, and often women will experience constant abdominal pain and a lot of the time bleeding. So if you ever have issues with abdominal pain in pregnancy, make sure you go and get things checked out at your maternity hospital to rule out conditions such as this. Another placental issue I wanted to chat to you about was placental insufficiency. This is a really big topic on its own, but about 10% to 15% of women will have some form of placental insufficiency where the placenta is not working so well. And this can lead to issues with baby's growth. It can lead to blood pressure issues or preeclampsia, which is another blood pressure condition in pregnancy. And it can also lead to adverse pregnancy outcomes. If you have placental insufficiency, we may notice issues with baby's growth on scan, or we may notice issues with the amniotic fluid amount around baby. You may have reduced fetal movements, and you may also go into labor early as a result of the placenta not working very well. So there's lots of things we can do to monitor baby's growth if you are having these kinds of issues, such as doing CTG monitoring of baby's heart rate at the hospital that you're booked in, having regular growth scans to check the growth and well-being and fluid around baby. And sometimes you will actually require early delivery due to the issues with baby's growth. The final placental issue I wanted to chat about today is a retained placenta. The first stage of labor is where you'll have contractions, and those are like period pains, and they will push the baby down in the birth canal and open up your cervix. The second stage of labor is where your baby will be pushed out through the birth canal and out of the vagina. And the third stage of labor is where your placenta, which is attached to the baby and also attached to the uterus, will actually be expelled from the uterus. Approximately 2 to 3% of pregnancies, we have an issue called retained placenta. And this is where after 30 minutes, we are not seeing the placenta coming out. Once the baby is born, majority of women will have an injection called oxytocin to help the delivery of the placenta. But in some cases this doesn't work and there are other things we need to do. There are a few little tricks we have to try and help the placenta come out, such as emptying the bladder, such as giving more medications to help the placenta shear off the wall of the uterus. But in a small number of cases, these things don't work and we actually have to manually remove that placenta. Sometimes we can remove the placenta in birth suite, especially if you have good analgesia on board, such as an epidural. But in some cases, some mums even have to go to theatre to have the placenta removed. Risk factors for having a retained placenta include an abnormal shaped uterus, such as a heart-shaped or bicornate uterus, or other forms of different shaped uteruses. Some women have had surgery in the past, which makes that placenta a little bit more stuck or adherent to the wall of the uterus. And in some cases, women have had a retained placenta before, and that puts those women at risk of having a further retained placenta. So I hope this was a really helpful discussion for you, and I hope you've learned something. And feel free to like and subscribe my YouTube channel, hit the bell for future notification, and I'll see you guys soon. Bye.